Psych NP clinicals are a lot different than Psych RN clinicals, so don't start until you know these tips. Hey, what's up guys, it's me, the Psych NP. It's always nerve-wracking starting new clinicals. I remember before I started my first Psych NP clinical rotation, I was really freaking nervous and anxious. But clinicals are where you learn the most real-life knowledge, so you need to make the most out of them. So in this video, I'm going to share my top 5 tips I have for surviving clinicals and making the most out of them. Let's talk about it. Number 1, be prepared before you walk in. Don't be that student where you just walk in on your first day and you have no idea what's going on and you have nothing with you. You really need to show that you're prepared and you did a lot of research beforehand before you start your first day. If your preceptor didn't already tell you what to bring on the first day, you should definitely ask them. My preceptor told me to bring my own laptop and even my own mouse because you want to be as efficient as possible. So you don't want to be using your little touchpad on your laptop to scroll up and down. You should just bring a mouse to make it easier for you. And I'm not just talking about being prepared before you walk in on your first day. You should be prepared before you walk in on every single other day afterwards too. Maybe arrive 15 minutes early so you can review all the patient charts before you start seeing your first patient. When I was doing clinicals, basically before I saw any patient, I'll just look up their diagnoses of what medications they're on and what their last progress note was. And then I'd make a plan in my mind, okay, if a patient's getting better, we can do this. If they're getting worse, we can decrease this. Or if they're having side effects, we can do this, blah, blah, blah. So you kind of already have a game plan on what to do before you see the patient themselves. Sometimes a patient can throw you a curveball that you didn't think about. But for the most part, you can kind of make a game plan on what you're going to do depending on what the patient says. Also, make sure to bring resources like the DSM-5 TR, whether that be the physical book or the app, whichever you prefer. And also something where you can look up medications of all their side effects, indications, contraindications, and stuff like that. I have a separate video on the top 5 resources that Psych NP students need if you want to check that out on my channel. But yeah, just be prepared before you walk in on any given day so you don't look bad in front of your preceptor. And then moving on to the second tip, show initiative. This is one of the most common tips for anything when you're new, but it really is true. If all you do is literally just sit there or stand there and watch your preceptor do stuff without offering to do it on your own or even help, you're gonna look like you don't even want to be there. Sometimes preceptors will often even want to teach you less if they see that you're not showing initiative and you're just gonna observe them. So you really want to show your preceptor that you're willing to learn and you're willing to do things on your own, even though you know you're probably going to make mistakes. Some examples would be if there's a new patient coming in pretty soon, maybe usually your preceptor does the whole admission assessment, but instead you offer hey, can I do the assessment with the patient, while you're observing me? Or maybe your preceptor only expects you to see a certain amount of patients per day, but you end up having some free time. So you can just be oh, can I see this patient too? Because, I'm not really doing anything. Preceptors can always tell the difference between a student who actually wants to try and a student who doesn't. So even though it's going to be scary a lot of times, just try to show as much initiative as you can. It's going to show your preceptor that you actually want to be there and they're going to want to help you learn more in return. And then moving on to number 3, engage actively. Now, this doesn't apply to only your preceptor, but to the patients as well. Regarding your preceptor, if they ask you things do you have any questions? And you say no every time, then it's kind of the same thing as the last point. They're going to feel you don't actually want to be there and you don't want to learn. So try to ask your preceptor as many questions as you have without being annoying. Maybe if you have a really straightforward patient who's easy to treat and your preceptor asks you hey, any questions on this patient? You could ask something oh, even though we did this and it's kind of a straightforward decision, what else could we do differently and why would we do that? And honestly, even sometimes when my preceptor asked me if I had any questions and I didn't, I would just make up some question in my head that I already knew the answer to just to make it seem like I'm engaged. And then regarding engaging actively with their patients, don't just be a passive listener. If they're telling you they're depressed and not sleeping, don't just be oh, okay. You could engage more actively and be okay, what are you feeling that's making you depressed? Are you not eating as much? Are you not sleeping as much? Do you feel down on more days than usual. Questions like that, where you're actively trying to listen and like understand what they're saying to you. Not only is that going to help you get more information on your patients, it's also going to help them build more trust with you. Like, just pretend you're a patient and you're seeing a student nurse practitioner for your meds, and they don't really say anything besides like, oh, okay, yeah, okay, okay. You're going to feel like they're not really interested in what you're saying and they kind of don't know what they're doing. So make sure you're engaged actively with both your patients and your preceptor. And moving on to the next tip, be professional, punctual, and reliable. Always, always, always arrive early, like always. Like if you're supposed to be there at 9 a.m., get there at 8:45 at the latest. There's gonna be things you can't account for, like maybe a traffic accident or you spill coffee on yourself in the morning or something. So if your plan is to arrive at exactly 9 a.m. every single day, one of those things is gonna make you late eventually. And then you're gonna look terrible to your preceptor. So I recommend giving yourself at least like 15 minutes buffer time between your actual start time and the time you get there. And you can also use that time to research your upcoming patients for the day. Like, yeah, being late once or maybe even twice might be okay, but if you're consistently late like every single day, you're gonna look like a joke. Your preceptor is not gonna take you seriously. Also, be present during your interactions with your preceptor and your patients, and actually all the other staff members there as well. So basically everyone there. Like if your preceptor is trying to like explain something to you or show something to you, and you're just like sitting there on your phone, like super distracted, obviously that's like a huge red flag. Like this seems pretty obvious not to be on your phone, but surprisingly, there's a lot of students who still do it. And then also maybe even like when you're on your lunch break and you're kind of like eating by yourself at the lunch table, don't just be scrolling on your phone while you're eating to yourself. Try to like introduce yourself to the other staff members and make conversation. It's gonna make you more likable and make you seem like you're more reliable too. And then also obviously keep it professional, respect everyone's privacy, boundaries, don't use bad words. A lot of these things I'm saying really seem like common sense, but yeah, many people don't do these things. If your preceptor asks you to do something, make sure you do it in a timely manner. And if you don't know how to do it, ask your preceptor. Don't just pretend like you know what you're doing and then you end up doing it wrong and then your preceptor doesn't trust you for the next time. So definitely don't just guess if you don't know how to do something, because the more often that you do something wrong, the less reliable and the less trustworthy you're gonna look to your preceptor. Also, don't try to show so much hesitancy when you're asked to do something you're not really like confident in doing. Like if your preceptor asks you to see this patient on your own and you're just kind of like, well, I don't know about that. That's also going to make you look less reliable and your preceptor probably isn't going to want to teach you as much anymore. And moving on to my last tip, talk with everybody. This includes your preceptor, the patients, the office assistants, the receptionist, the janitor, literally everyone. Don't just keep to yourself and be that student who doesn't say anything. Because then people think like you don't want to be there, you just like stay by yourself in the corner and they don't bother trying to involve you in things that they're doing. And it just makes you less likable in general, to be honest. So anytime you walk by somebody, if they're not like busy, just try to make conversation, even if it's just like small talk. Like honestly, I hate small talk, but it actually is a pretty good rapport builder, especially for people that you don't know. Try to make it like entertaining small talk at least though. Don't just be like, oh, hey, nice weather we're having. So as an introvert myself, I know how hard it is to like do this when you're introverted, but you've literally just gotta like put yourself out there, just be as sociable as you can. It's gonna go a long way. It's a lot better when people at your clinic are happy to see you instead of just like, you know, when they see you, they just go back to whatever they were doing and don't even bother like looking at you. And you're gonna be at that clinic multiple times, so it's really worth it to make friends with everybody. And also, who knows, one of those people might end up being a connection for a possible job later on after you graduate. So those are my top 5 tips I have for Psych NP clinicals to make the most out of them. Honestly, you can walk into clinicals without knowing anything about Psych NP, but if you follow these tips, it's gonna make it a lot more enjoyable for you. If you found this video helpful, make sure to like and subscribe. I do videos on Psych NP career stuff and also just general psych stuff as well. I am also on TikTok and Instagram if you want to follow me over there at the Psych NP David C. I do medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.